This is Lori Whitman. In 2019, Lori began a new role at Parkview Health, a healthcare system that employs 13,000 healthcare workers across 10 locations in Northeast Indiana. When she began, Lori didn't know exactly what her new job would look like. And then 6 months into it, the COVID-19 pandemic began. She wasn't sure what she would do or how she could help people. This is Tony McCarrol, a catering and banquet manager at Parkview. He too suddenly found his job to be unrecognizable when the pandemic began. He was reassigned to another location and asked to fill whatever at-your-request role was needed at a given time. This is Jentgen, who works in the emergency department at Parkview. For years, she's been used to being exposed to infectious diseases at her job. But suddenly in 2020, she went home from work and the disease was still there. She went to the store and the disease was still there. Everywhere she went, the disease was still there. This is Will Curry, the pastor of a church in Fort Wayne and one of the many chaplains at Parkview. As he led and shepherded others through one of the darkest seasons in recent history, he thought often of the biblical story about Job. Tragedy was all around him. This is Dartanya Williamson, a manager in Parkview's financial clearance and counseling. Dartanya has been at Parkview for over 20 years, but 2020 became especially hard when a close friend of hers, a director whom she worked with, passed away from cancer. This is Dr. Joseph McCollom, a GI medical oncologist. In the middle of watching the world suffer from the multiple waves of COVID-19, Dr. Joe was responsible for staying with the fight against cancer. Normally, he would spend lots of time in person with his patients, but now most of his human interactions had been reduced to a video call. And this is Rose Encabo, an expert RN in wound care. While working to serve her staff and assist in research, Rose found out that both of her elderly parents had contracted COVID-19. Whenever she had a break on her shift, Rose would stop by each of their individual hospital rooms at Parkview and see her parents from behind the glass. Her mother eventually died from the virus. And though her elderly father survived, his dementia was so bad that he never realized that his wife was gone. Behind every face is a story, a sorrow, and a spirit to keep going. Before the COVID-19 pandemic, none of these men or women knew what the other was carrying, even though they all worked at Parkview. And then one day, an email appeared in the inbox of all 13,000 health system employees. It was Rose, on video, talking about her parents, sharing her moment of grief, but thanking the hospital for a small act of kindness, allowing her two parents to be in the same room before her mother passed. That her coworkers would do that meant so much to her. Rose told everyone, "I'm lucky to be a Parkview employee." Before that, there'd been a video of Dr. Joe, giving thanks for the modern technology that had allowed him to see a patient on a video call, a patient who he noticed was slouching in a strange way. Dr. Joe told the patient to immediately go to the hospital, where surgeons discovered a brain bleed and were able to save his life. Around that same time, there had been another video with Dartanya Williamson, who was so proud to be helping people afford the medical care they needed. She reminded everyone that loving others was the greatest goal of their work. In his video, Chaplain Will Curry talked more about Job and shared with everyone that in the last few weeks, his grandfather had died from COVID-19. And then his mother. Despite his deep sorrow, Chaplain Will Curry ended his video with a prayer for his co-workers. He prayed to God, "We ask you that you give them a lifted up spirit, not a spirit of defeat." Jentgen, the ER worker, revealed that she was the one making sure everyone in her emergency department had a mask. The right number, on the right days, in the right hands. No task was too small or too insignificant. And Tony McCarrol, the catering manager, shared that because he had been reassigned, he had found himself preparing special dinner requests. Only later did he realize that he had the quiet, holy privilege of serving others their last meal. Tony's video reminded everyone, what we do, it matters. Every weekday, a new video came out. It was called The Daily Dose. First, there were 10, then 20, then 50, then 100. Each one a story, a job, a purpose, a life, a struggle, a prayer. Nurses would watch The Daily Dose during their huddles. Teams would gather to listen and to pray. Others would watch from home, even on their days off. There was rejoicing with rejoicing. There was mourning with mourning. The unseen were now seen. A 13,000-person staff became a 13,000-person family. And behind all 249 Daily Dose videos was Lori Whitman, who had found herself at the beginning of the pandemic unsure as to how she could help people. She began meeting with her team. She prayed. And that's when it came to her. The Daily Dose videos. God had given her a grander vision.